Are you tired of patients coming into your office complaining about loose dentures? Well, honestly, I'm tired of it too, but I want to share with you a couple of tips on how to make really well-fitting dentures. The first one I want to share with you is how to adjust your custom tray. Seems like a really kind of ridiculous little thing to focus on, but that's where it all starts, so I'm going to show you how I do it for my patients. So when you're making a denture, essentially what you're trying to do is to grab onto as much ridge as possible without disturbing any of the movable tissue. You see how some of this tissue is moving around. There's frenums, so there's attachments, and all this stuff moves when the patient talks. And so you want the denture to grab onto as much as possible without interfering with these areas. And so I'm going to go ahead and show you the way that you adjust your custom tray. So adjusting your custom tray so that it's not overextended, that it's not pinching on any of those frenums, any of that movable tissue, is going to make sure that you have a well-fitting denture. This is where it all starts, and I think this is where we often get it wrong right at the beginning. So I'm going to show you how I adjust all these areas of the custom tray. So first I put the custom tray in the patient's mouth, and then I wiggle their cheeks around. So I'm actually just moving their cheeks. You see me pulling down their lips, pulling down their cheeks. I don't like how my handle's kind of sticking out the front because it makes things harder for me. So I actually like it when the handle's sticking straight down. But I wiggle the patient's lips around, and I pull down, and anywhere that it's interfering, it's going to displace my tray. See how here the frenum is pinched? So when I pull that lip down, it's actually going to push my tray out of the way. And so what I actually do is I go all around the mouth and I push down, and wherever my tray is pushed out of the way, that's where I know I have to adjust. So my tray is pushed down, my tray is pushed down back there. See, I'm just like pushing down on that cheek. And so that means I have to adjust, because if my tray is being knocked out of the way, that means the denture will be overextended there. So I'm going to first make sure my tray has shorter extensions. I'm basically checking all the areas in the mouth that the movable tissue bumps the tray out of the way, and I'm adjusting that on the tray so that in the end none of it will be pushing the tray, right? So here it's a little bit better now, and here it's much better. So now it's not pushing my tray out of the way there. So I'm just going to kind of talk through these different sites. Checking out the posterior most part is actually the most difficult. You need a mirror, you need really good light, but it's super important. See here, I am still bumping my tray out of the way with the lip, and I need more space for those frenums there. So I'll show you. I'm going to adjust it in just a moment. But I mean, I probably spend like a good 15 minutes, 20 minutes just adjusting my custom tray before I get started. I mean, per arch. So that's what those frenum look like without the custom tray. So sometimes it helps just to remove the tray, go back and put your tray back on and make sure it's adjusted properly. All right, so now you can see that the tray here in the front is not impinging on that frenum, and so that they can freely move, and it's not going to displace the tray, which means it won't displace the denture, which means your denture won't fall out. All right, so that one's good. I'm going to go to the side here. That one's good too. That tissue looks like it can move around freely without that tray pinching. And here, let's look at a couple more sites. Now I'm looking at the distal aspect, so all the way in the back. That looks pretty good. It's not pushing my tray out of the way. Notice how I'm holding my tray with one hand, and I'm using the other hand to try to displace my tray. And right here you can see nicely that that it's not being pushed out of the way at all, and that frenum has a lot of space. Alright, so I hope that helps. Like I said, I do spend a good amount of time adjusting the custom tray before I border mold and take impressions, because if that's not done right, everything else is going to be wrong. So I hope this video helps. In the next tip, I'm going to share with you how I border mold.